treatment called TomoTherapy that reduces the amount of radiation to healthy tissue, the heart, and lungs. Dr. Daniel Landis is a radiation oncologist who leads the TomoTherapy program at Swedish. It's great to have you here. Let's talk specifically about breast cancer patients because this treatment does really help breast cancer patients. What exactly is TomoTherapy and how does it work?
TomoTherapy is a type of external beam radiation therapy that's used to treat cancer patients. What's unique about it is it's a helical delivery platform. So you can imagine a patient lying on a machine that looks like a CAT scanner, and the patient would go through and it would spin around the patient as they're going through. So imagine taking an orange and peeling it in one continuous slice. That's sort of how our machine treats. That's advantageous because it gives us a lot of control and precision in shaping a beam around curved structures like the heart or the lung, or treating very complicated tumors.
So it's more specific to that area? And so in other ways, how is it different from other types of treatment?
Instead of setting up this particular beam and angle, it allows this continuous approach. So it does allow more specificity and for sparing normal organs. And our hope is that that would then lead to reduced long-term side effects.
So who are good candidates for this treatment, or is anybody able to take this on?
Big picture, it tends to be very useful when you're dealing with a complex tumor, complex shapes, large tumors, a long tumor, or when you're trying to deal with a critical organ that's nearby, like the heart or the lung. It's sometimes difficult, even for us as experts in doing this, ahead of time to predict who would be the best candidate. So the best way to go about finding it would be to see a radiation oncologist at the Swedish Cancer Institute, either at our downtown center, the True Family Women's Cancer Center, or in Edmonds, Issaquah, Ballard, or down in Highline. And at that point, the radiation oncologist would meet you, and they would do what's called a radiation simulation, or a planning appointment. And that's when we start the process of developing the different beams and angles and figuring out what would be the best plan. At that point, if it looks like the TomoTherapy is going to have an advantage, then the patient would be referred over to our center in Ballard.
Are there any risks with this type of treatment over other kinds?
You know, it's the exact same kind of radiation that comes out of the machine as in a conventional machine. So the difference is in this delivery platform and how it's delivered. So I don't foresee any increased risks in it at all. The cure rate should be identical. We're not actually shooting for higher cure rates. What we're shooting for is the same cure rate with lower long-term side effects.
So there are more side effects with other types of treatment compared to this one, and why?
Well, there are pros and cons to every machine, and so really what the approach that Swedish has taken is having almost every possible machine available, and you can then optimize for a particular patient. So it's not so much that one machine is better than another, it's that different patients would be most suitable for different machines, and we want to optimize and individualize that care.
Gotcha. This is also a good time to remind people to get mammograms because it is Breast Cancer Awareness Month, right?
It is, and the American Cancer Society recommends mammograms for all women starting at age 40 yearly while they remain in good health. And I can't stress enough how important that is and how many young patients we see in our clinic.
Early detection is key. Dr. Landis, thank you so much for your information. We appreciate it. Let's toss it over to Tracy T. Find out if the Friday commute is any better than the rest of the week.